All right, very much. Okay. Welcome everyone to our regularly scheduled Governor Committee meeting for tonight, September 4th, 2024. At the table, we have a full house tonight. Part of our committee members are Councillor Fish, Councillor Foss, Councillor Schaefer, and Councillor Trimble. At the table, we also have Councillor Fournier, Councillor Dean, Councillor Fish. No, she is part of the committee. Councillor Chair Peltier, and we also have Courtney O'Donnell, who is assistant to the city manager, and she's going to start off with the first item on the agenda. We have guests.
We do. Catholic Charities of Maine presentation. Would you like to introduce yourselves?
Sure. My name is Steve Letourneau. I'm the CEO of Catholic Charities Maine.
And I'm Melissa Buchholz. I am the Assistant Director of one of the programs in Catholic Charities of Maine, which is the Refugee and Immigration Services Program.
All right. And so I will pull up their presentation.
So just before Melissa does this, I want to thank all of you for the opportunity. One of the things that we try to do as a statewide organization is be value added to any community. And in Bangor, we've had a rich tradition and history of serving out of the St. Michael Center in Bangor and Kenduskeag. We've actually moved to Brewer. However, all of our clients, everybody we serve still is representative of all of Penobscot County through a variety of programs. We have 24 programs statewide. We're here today to talk about one particular one that Melissa's been leading for 2 years now. And so the director of the program is on a much needed vacation, so I'm here as support to Melissa.
Great.
Thanks.
You can use that arrow there to.
Well, perfect. Well, thank you guys again for inviting us. And I want to echo what Steve said. Like I said, my name is Melissa. I've been at this office since October of 2022, which is when it first opened. So I've kind of been here since its inception, first as the Bangor site manager and now as the assistant director in Bangor. And I'm here to just kind of provide a bit of an overview of the last fiscal year with our refugee arrivals, also talk about the next fiscal year. So we're starting kind of going over what services we provide, and specifically the populations that we serve. The first services that we provide is the reception and placement services. These are 90-day services for just two specific populations, refugees and special immigrant visas. Now, we also do refugee support services, which also expands to refugees and special immigrant visas, but also includes asylees, secondary migrants, victims of trafficking, and Cuban Haitian entrants. So the blue one, 90 days, and then the yellow one is actually for 60 months. And again, the blue one is just for the refugees and special immigrant visas, whereas the yellow one includes all of those 4 yellow categories, as well as refugees and special immigrant visas. That's just to kind of put, I'm going to be talking about these terms a lot, and just to put you in context of kind of the services that we provide at Catholic Charities. So looking specifically at our last fiscal year, this is just those populations kind of spread out on who we've been serving. Majority of our clients that we've been working with have been the refugees. We've worked with 87% of our clientele is refugees. We also have a little bit that we do with Cuban and Haitian entrants to make up about 10% of our clientele, and then just a really small amount with Ukrainian humanitarian parolees and asylees as well. We just also have this here just to provide countries of origins of all the folks we're serving. We work with folks coming from 11 different countries. The main 2 countries of origins that we serve are folks from Venezuela and folks from Syria. You also see that I think the next represented number is going to be Haitians, excuse me, as well as Nicaraguans, followed by other folks represented in parts of Central South America, Afghanistan, and so on. This is kind of reiterating in some ways, just looking at the language part. So as we said, our majority of our folks are from Syria and Venezuela. It's only natural that the main 2 languages would be Spanish and Arabic. There's also other languages that our clients speak, and most of our clients also speak more than one language, but these are just their preferred languages that they use. This is also something we've just been collecting recently from the last fiscal year. I was just going over ethnicities of our clients. So Arab, Hispanic, Black non-Hispanic, and Creole ethnicities are the ones most represented within the Bangor area. I just want to take a moment. This is the perfect opportunity looking at this graph. So Catholic Charities of Maine in the Refugee and Immigration Services Program. Bangor is not the only office. There's offices in Portland, in Lewiston, also Augusta. But obviously I'm here just speaking about Bangor. So all these numbers we're providing is just on the Bangor office. So this graph just looks at the ages that we serve, divided into 4 different categories. The first category being children 0 to 5, so really small kiddos, preschool age, kiddos from 5 to 18, which would be school age kids, employable adults, which would be folks 18 to 64 years old, and also folks from 65 years old and older. So in the Bangor office, majority of our clients are employable adults, so folks in that 18 to 64-year-old age. I think it represents around 60% of our clientele. 30% would be the children at school age, which is around 30%. And then the last 10% is, again, those kiddos at that 0 to 4-year-old age category. This is just looking at family composition of how many single cases we have via the total families. Usually within the years, these numbers are kind of the same in terms of individual cases and family cases. I think this year we have just a few more single cases, but they try to be balanced of different compositions of families. This goes again with that family size, just talking about how big those families usually are. So this statistic is taken out of all of our family cases and seeing what the average is. And usually across that state, it usually is around 4 people per family. Obviously, some have bigger families, smaller families, but that's usually the average.
And we're flying through these slides, so
Yeah.
there are questions we're planning to ask answer at the end, but feel free to jump in if it's pertaining to a particular slide.
Right, so this is just kind of showing what I was talking about earlier, which is the arrivals, but I'm looking at it through a month-by-month analysis. So as you can clearly see, there's 2 months. I think the sharing thing is over it. Yeah, January and February were big months in our Catholic Charities office for RIS. You can see we had a lot of arrivals. Those aren't something that we get to choose. I don't think I would willingly choose to have that many people all at once. I'd rather be spread out throughout the year, but January and February were big months for us, and you can kind of see how there's been a more steady pace since May. And then also you can see the other populations that aren't refugees sprinkled throughout those different months as well.
Is that it?
I think there's someone.
Sorry, I might have now try. There.
There we
There you
go.
go. So this is just looking at those numbers again. So this last fiscal year, which was October to this September, we were anticipated to resettle 100 individuals. We've gotten 84 of those individuals so far as of August 6th. I'm sorry, that number is wrong. It's August 6th. And our site supported additionally Ukrainian humanitarian parolees, Cuban Haitian entrants, as well as asylees. Looking specifically at employment services, we had 64 employable adults. Like I said earlier, those are adults ranging from the ages of 18 to 64. And of the 64, we had 56 job placements, which I think was around 87%
Yeah.
who joined the main workforce. We've been working with 22 different employers, 3 of those who are new employers. These 3, Sodexo, 3 Point Cleaning, and Eastern Basements are just some of the top employers where we placed clients in employment.
This generally is one of the areas that we get most of the questions around because there are a lot of myths and misconceptions about refugees and looped in with asylum seekers, but they're completely different individuals with different opportunities. So a refugee, the day they arrive, which they're arriving at the invitation of the federal government, which is why we don't have control over when they do it, they can work day 1 if they're an employable adult. And it's up to the agencies that are resettling them, like Catholic Charities, to prepare them, set them up for success and make the arrangements with particular employers, which Melissa and her team have done a fantastic job. 87% for this year is really actually quite exceptional when you look at national trends.
And this is just looking at that employment services more spread out again throughout the year, month by month. That's on the top part. You can see the March and April were really big numbers for placing folks in jobs, likely following those January, February arrivals. So we seemed pretty quick to place those folks in employment. And then that bottom part is just all the employers that we work with. You can see again, Sodexo, Eastern Basement, and 3 Point Cleaning have the top numbers, but they're spread through a wide variety of different employers throughout the area.
What is Sodexo?
Great question. Sodexo, they took up the contract with the University of Maine as the dining center. So it's like UMaine Dining Center.
Right.
All right, looking ahead to fiscal year 2025. So with our resettlement office, we work within the 100-mile radius. Usually that's focused on the Bangor and surrounding communities, but we can work within that 100-mile radius. And we are hoping to resettle 150 individual refugees in fiscal year 2024. So that would be starting October 1st of this year till September of next year, which is a moderate increase from the 100 individuals in the last fiscal year. Just talking about community integration, some strategies and barriers. Some strategies that have been really supportive to community integration was employment, workforce development, as you guys know. Additionally, common messaging about the housing crisis and limited resources. A lot of folks, when they arrive, they might not know that we're in a housing crisis, so it's really important finding housing, keeping housing, securing housing. Also focused on financial literacy, making sure people are following budgets and just how to budget for things as well. Also English classes, of course. English classes are flexible either before work, after work, and for some more folks even during work. And now the barriers for resettlement and community integration, like we saw earlier, the pacing of refugees. We're hoping within these future fiscal years, we've entered this pacing pilot program, which is a lot of P's. And that is to kind of help with that pacing. So hopefully there isn't that huge leap, but just consistent refugee pacing throughout the year. Black and affordable housing, of course. For smaller cases, so they're individuals, couples, single parents, there's a lot, their budget's quite limited. So that's, of course, a barrier for those folks who fit in those categories. Misinformation, also just making sure we're having a fully staffed office. But that's the end of my presentation, but I also wanted to leave time, of course, if you guys have any questions for me or for Steve.
Okay, Melissa, any questions? Yes, Councillor Fish.
So you're one group that helps to settle the refugees that are coming in. Is this a government mandate, the numbers, like I see Bangor, you had 100 people that you wanted to bring into, is it Bangor or their communities? Do you know how many have settled into Bangor? How many you settled? And then the 150 you have planned for the upcoming year, are you planning to bring them into Bangor or and how many, if it's going to be the outlying communities as well, what percentage of these people are settled in Bangor?
Yes, that's a great question. So all these numbers were specifically in Bangor and could be expected for Bangor. We settled like Old Town as well, and Orono, Brewer, those are all communities we also work with. Usually a lot of our placement depends on housing, where we can find affordable housing for folks.
But you have the capacity to resettle within a 100-mile radius. It's just the closer to proximity of our staff, the more successful they generally are. And if the community has a lot of natural support, so the Multicultural Center has been really fantastic for the success of this program. And so generally it's around the Bangor area, but some of the I know Old Town's had some as well.
Councillor Dean.
Given the current housing shortage, when they do arrive, do you have a relationship with a particular hotel or motel? Where are where are they being placed before you find homes?
Yeah, so usually we work with landlords prior to arrival. There's some landlords we've been working with in the area to get folks placed in permanent housing as soon as possible when they arrive.
We really tried hard not to utilize hotels at all. In the Portland area, we actually are creating a welcome house so that for that transition until we find the landlord, that usually sets them up for success, more of a home environment. Yeah, you've been pretty successful actually cultivating the landlords prior to even having the arrivals. A little more difficult in February and March when they came in fast and furious, but you're able to do it.
Yes, Councillor Fish.
If you have a relationship with the landlords, how does that work? Do they have an incentive to cooperate, to make housing more available to refugees?
I don't know if there's any financial incentive or anything like that. Most of the time, we just explain about our process, folks that are just willing and able to work and just trying to get them houses as soon as possible.
I mean, yeah, no, there are no like exceptional financial benefits. They will get a market rent usually. That's so, but it's nothing above and beyond. Yeah, one of the things that we've acknowledged and recognized, especially over the last 10 years, as more people learn about a refugee as compared to an asylum seeker or somebody other immigrant. The more people learn about them, the more people want to help them. And so I think there are many people that own units and have capacity within their system and want to, or they might even be immigrants themselves, and so they want to help. And so we've had people reaching out to us to say, hey, do you need apartments or homes to rent? So I think that's one of the things we know that does happen.
I'm just curious, where we have a housing shortage. And, you know, I just concerned that we have, you know, Bangor residents, where we represent Bangor residents.
Sure.
And 100 or 150 a year, 150 apartments or 100 apartments is a pretty significant impact within our community. And while we're very compassionate and you know, want to help people
Sure.
that are definitely struggling and in worse situations than we are here in America and Bangor, at the same time, 100 apartments or 150 is pretty significant.
If I could
and
just
we already
clarify
have-
on that, I totally get where you're going with, the 100 that we resettled. I would say it's half of that in terms of units, because most of them are families.
Maybe even a quarter, actually.
A quarter, so yeah, probably 25 to 30 is what we really need, not 100. But it's still significant when there is a housing shortage. It's a national problem. And I hear it from colleagues running resettlement agencies everywhere. It's a housing crisis, yeah.
Any questions? No more questions. And I want to say I work very closely with Melissa all the time. I appreciate working with you for the last year and or so. And I think the community's reaction to the refugees has been amazing. Neighbors have been very helpful because we assign teams to work with families, and then suddenly the family is not asking for help much. And then like I reach out, what's going on? Oh, the neighbor is doing everything like for them, taking them. And so the community reaction has been really amazing. So yeah, I think it has been good. And I appreciate that you raised the point about it's a federal government thing that they assign these numbers to the Bangor area. It's not Catholic churches, it's not any other organization, it is the federal government. So I think that's important too.
And we
To
do work
highlight
in,
as
yeah, and
well.
we do work in partnership with the federal government, but also the local community. So if there was, the local community really had a difficult time. If we weren't able to present data that supports they're in a home, they're working.
Employment, yeah.
Employment, and there's, like I said at the beginning, we want it to be value added. There are some challenges, significant challenges, especially around housing. Actually, it's a lot worse in Portland. But I think we're overcoming that because I think it's been a good community approach to the whole,
And
to
I
the whole program.
Yeah, and I also believe the gradual assignment of these families. I feel like if you send 500 individuals
Yeah.
in 1 year, I think that will be overwhelming to the community. And I don't think you'll have the same reaction as when you have it gradual and well organized.
And I think that demonstrates the difference between something like refugee resettlement, which is a much more planned approach to immigration, versus you could get 500 people within a week from the southern border that are asylum seekers. I mean, that's happened. Big migration into Portland at different times. There's absolutely no control over that. At least with refugee resettlement, it's a planned approach that's proactive and hopefully setting people up for success. But not only the people that we're resettling, but really the community as a whole. The people that are looking, I mean, I can't believe how many people are calling me for employment. or for us to provide refugee resettlement to their community. It's because they need workforce. The problem we're finding is housing is really the biggest barrier. It's not work. 10, 15 years ago, it was work. But now it's housing.
And quality of housing as well.
Well, yeah.
I guess,
Yeah, Councillor Schaefer. yes.
I just wondered, is there then, so we've had 100 folks this year and there's 150 coming. Are those 100 people that have joined us, do they help provide support even just to the new residents, even if it's just a cultural connection, even if it's just a social connection? Is there that kind of?
You can speak to that.
Yeah, I would say most people are eager to connect with the community of people that are from the same country or area that they're from. Most people when they arrive from some places, they'll be like, Melissa, where are the other people of my country? Give me their numbers, and making sure that everyone's consenting to that, of course. But
Right.
usually people are eager to connect. Some even will cook a homemade meal for them when they arrive, which is, I think, a beautiful way to kind of enter as being connected to where you're coming from.
I just know that Catholic Charities is new in our area. Like, was it last year was the first? is
Well,
this
it's
the first?
new providing refugee resettlement.
Yes,
Yeah.
yes.
I have to say that because this
Correct.
this program across the state gets 90%
Yeah.
of any media coverage there ever is, but we served 52,000 people last year.
Yeah.
2% with the refugee program.
Yeah, for the clarification, was
Yeah.
this the first year that Catholic Charities was doing refugee resettlement in
Second
Bangor?
year.
Second year.
Yeah, the first
So-
year was what, 45?
Yeah.
50?
50 was the project. I think maybe
Yeah.
49 arrived.
Okay, so as it's going, I can almost see it being with our main multicultural center, there being just sort of like an organic community building happening as well, which
It
is nice. That's good to know.
It
Thank you.
is truly, yeah. Councillor Fish.
I have a lot of questions. I'm a new counselor this year, and this
Sure.
is new to me, so I just have a lot of questions. So thank you for your patience.
And you're welcome to reach out to us. I can leave cards, reach out to us anytime with any questions.
So if we're a sanctuary city, was that mandated by the government, or in the past, did city council to be decide to become one, or how do you become a refugee
I-
destination?
I'm not familiar at all with whatever sanctuary city's status is. We don't get involved with any of that. I don't know anything about that,
Okay, well,
so.
refugee destination.
Yeah, refugee resettlement,
That's
we can answer that, yeah.
Refugee settlement,
Yeah.
is that mandated, or how do you?
So every state in the union has a refugee, actually, there may be one that doesn't, but has a refugee resettlement program. Most of them are run by the state. That in Maine always used to be. And so, and as part of the United Nations agreement, so the United States participates in the refugee resettlement across the world. And as part of the United Nations, they get a share of the refugees from the camps where they're coming from. And then within the United States, the Office of Refugee Resettlement helps to distribute those to the various 50 states and entities that have resettlement programs. And then within the states, it's the resettlement organizations that are responsible for working with communities to try to build capacity to, set people up for success when they come in here. And to set the community up for success, because I think most communities thrive, as years go down the road, you see the benefit and the value added by the immigrants that have come into the community.
And I see
Yeah.
there's parolees, what can you describe to me how they're handled, and what is a parolee?
Yeah, so those are specific folks that the government recognizes as a humanitarian situation happening in our country. I think a good example is Ukrainians. So obviously there's a humanitarian crisis happening there. So they have a different process. And I'll try to make it a bit short, just because I live and breathe in this field, and it's sometimes really complicated these and new to the field as well. So there's different ways that Ukrainians can come to the United States. And so one of those ways is through a sponsorship. Let's say someone's daughter lives in Bangor and they want to have their grandparents from Ukraine to come with them. They can sponsor them and be like a financial support for them. And so when they arrive to Bangor, they reach out to our office saying, hey, I'm here with this person from Ukraine. Can we get some services for case management support?
The word parolee can throw people off. Early in my career, I worked with youth coming from the detention center, and when they were on parole, it wasn't always a good thing, right? But parolee does not mean something negative in this.
Thank you.
But I thought so at first, so.
Thank you.
Okay, any more questions? Okay, I guess that's it.
Thank you very much.
Thank you.
Thank you.
Thanks.
Thank you so much. And we move to
I can
our
read
second.
these. I can read
Yes,
these. Anybody wants to
absolutely.
call?
Thank you very much,
Yes.
Steve.
Thank you.
All right.
Okay.
Yes, up next, we have a Built for Zero presentation, and I believe, on Zoom, we have folks from Maine Housing, Kelly Watson and Tara Hembry. And I believe, Jen Jones is joining us as well, and so not sure actually who's gonna take lead on this presentation, but I guess we'll find out.
I believe Kelly and Tara.
Okay, great.
Hey, everyone. I'm Tara Hembry from Maine Housing, and beginning to work closely with Jenna at the city. And she asked us to follow up on some data and information based on the work that we've been doing with our homeless response system redesign and looking at Hub 7 in particular, where we're talking about Penobscot and Piscataquis County. And sorry, Kelly, go ahead and give you one.
No, that's fine. You're taking the lead on this, so I'll just introduce myself and pass it back over. But I'm Kelly Watson. I'm the director of the Homeless Initiatives Department here at Maine Housing. And again, Tara's going to take the lead on this, but here to answer questions that might come up that I can help with. Thanks.
All right, so I wanted to start out because my understanding is that there's been an ask for some data from all the work that's been happening with the hub and the homeless response system. And so I wanted to kind of frame this in a few different pieces. I wanted to provide you some data from our homeless management information system we refer to kindly as the HMIS, which is the database that stores all of the data, all of the homeless information that we collect from providers that are willing to enter data into the system. Some providers are mandated. If they receive federal funding, then they're mandated to enter their data into the system unless they're a domestic violence agency, and there are prohibitions for them, and for them using HMIS, they have to use a comparable database. So the information that I'm going to share with you today is information based on what we have within our HMIS, and that is again for providers who are mandated or willing to participate in the system. I do have a presentation, but I did not send it out. Can I share my screen, and will you guys be able to see that if I share some slides? Because this will be really boring if I just talk.
Go ahead, try. I should be able to give you
Okay.
permission.
All right, perfect.
Let me know if it doesn't let you.
Sure.
Yay.
Okay, great. And I'm going to move this over here so I look like I'm talking to you. Right. Oh dear. Okay, so here we are today, and I wanted to start out with talking a little bit about the programs that are kind of significant to Bangor that currently exist. So I know that this is kind of in the realm of BFZ, which I'm going to talk about and a little bit more, but I really wanted to give you guys some context and some data based on the information that we have from our HMIS. So right off the bat, I wanted to mention that the city of Bangor runs a permanent supportive housing voucher program. It was kindly and fondly referred to for many years as Shelter Plus Care, which is a low barrier voucher for individuals who have a disability and either in a mental health or co-occurring substance use disorder. And it's a really amazing opportunity for individuals that may have barriers that would prevent them from accessing other housing subsidies. And sorry.
Yeah, sorry, the City of Bangor programs is on a little next slide section.
Yes.
We're seeing
So,
the-
yeah, oh, can you see? Sorry, I can't figure out how to do this presentation thing here. So, are you able to see are you seeing my whole presentation here? The whole
Yeah,
slide? Okay.
The side that shows your notes and things.
Okay. Okay, so maybe that's not what I need to share. Hold on.
I mean, on this one, you don't have any notes, so.
Let me see. Stop sharing. Sorry, let me try this again. So let's try this.
Yes,
Are you
there we
seeing
go.
one slide?
Got it. Yeah.
Okay, thank you. All right, so this is confusing because there's multiple. Okay, all right.
There you go.
So
Thank you.
anyway, can you hear me?
Yes.
Okay, very good. All right. So one of the things that I was talking about is that the city of Bangor itself runs a permanent supportive housing voucher program, and I kind of gave you the overview of that. The city of Bangor also runs an outreach program. And just for context, I also wanted to include the 3 shelters that enter data into HMIS that is part of this, that are located within the city of Bangor. So you have Shaw House, which is one of our the youth shelter. You have Bangor Area Homeless Shelter, and you have PCHC's Hope House. So those 3 shelters are also included in this presentation. So I just wanted to give you some numbers, and I ran this just for this year. So from January of 2024 through the end of August of 2024, there are some data that will get entered after the fact, but this is as good as the data, but this is as good as I could get on the date that I ran the reports. And for the year, for those full months that I indicated. So you can see here for the rental assistance program, there's 124 persons served, and the number of adults were 109, and there are 15 children that are part of that 124 folks that were served. What I will say is that this is not people that are necessarily new to the rental assistance program to the city of Bangor. These are folks that were present within the program within the time frame that I ran the report. Similar for outreach, we have over here, we have the outreach, we have 25 persons served, 23 adults, that included 2 children that were enrolled in the city of Bangor's outreach program. And then the 3 shelters combined, we have 450 total persons served. And because some of them are more of a lower barrier shelter, we're not seeing as many children. There's not really family shelters within the shelter system. So these children may even be part of our I didn't splice them out. I create a reporting group to get the data, but these might even be children that are enrolled with Shaw House under the age of 18 as well. So some significant data that you can see here is I like to point out the number of people that have been served within the programs, and then the number of leavers. So where are people going from where are people exiting these programs? I wouldn't expect to see a lot of people exiting rental assistance. Generally, that's something where they end up, requiring that assistance for some time. But you can see that there has been some turnover and people have moved on. Whether that, the reasons for that, we can take a look at I'll take a look at where people are going when they're leaving the system. Based on these 3 categories. And then we have, so outreach, you had some leavers that were enrolled in the program and have left, but there's still people continually to be enrolled in the program. And the same thing for the shelters. So 347 leavers from the shelters. Shelters, a lot of times people will stay for a day or 2 and end up re-enrolling. So sometimes it's a little bit of a revolving door, and people may not be staying for long periods of time, but it could be the same person that's being served over and over again too. Let's see. So, all right. So prior living situations, and I'm sorry, this is a little small, but I tried to capture as much data as I could in here for you. What I will say here is these are the places where, based on client self-report, when they were entered into the different programs, and again, rental assistance, which is the permanent housing, the outreach program for folks that are sleeping outside, and then the shelters, Shaw House, PCHC, and Bangor Area Homeless Shelter. So you can see that folks, for the rental assistance program, about 30 people that are currently in this program came from a place not meant for human habitation. 70 came from people that were living at the shelters, probably one of the shelters. These shelters, they're sitting over here. Most of the outreach clients came from a place for not meant for habitation, which makes perfect sense. You can see that some also were exiting a medical facility or jail or prison. So these are the categories that we're always thinking about in the homeless response system. So homeless situations, institutional situations, temporary situations, and then our permanent housing situations. And then the shelters, we have lots of people that are coming from outside. We have people that are coming from another shelter. Maybe they were in the shelter and they come back. You see folks that have been exiting hospital and other institutional settings, 59 subtotal, and then temporary situations. So maybe they were staying with friends and then or family and it didn't work out. And you have a subtotal here from the shelter of 117. Questions so far? Okay, I'm gonna move us
So
along.
sorry.
Go ahead.
I just want to go back to the previous slide where you said there were 450 people total. Sorry, maybe it's one more back.
Okay.
But that's not unique users. That could be the same person multiple times, or is that you?
This would be, Kelly, can you help me out on how we deduplicate these capers?
Yeah, the CAPER, sorry, we're using acronym speak, it's a report. It does deduplicate. So it, based on identifying client information. So if a name, parts of a name, date of birth, and parts of a social match, it would consider them one person. So likely that it one to one person, but there could be cases where someone reports a different name, social, or date of birth that counts them twice because of that.
Perfect, thank you.
Thank you.
And again, this is for that was for 3 shelters. We just grouped them together, so we weren't looking across the board at so much data. Let's see. All right, so we talked about we talked about prior living situations where people who were.
I kind of looked at the council, at the committee chair, sorry, you're behind.
Going on.
So can you go back one more slide, Kelly and Tara?
Mhm.
I just wanted while you were on that slide, I wanted clarification. The first column, you reference it as rental assistance, and you tie it specifically to the city of Bangor's, formerly known as Plus Care Program.
Yes.
And the outreach is specific to the city of Bangor, correct?
Correct.
So, but the city of Bangor is not the primary organization charged with providing rental assistance, nor with doing outreach. So do you have information similar to this regarding the rental assistance that was provided through Balance of State, or the PATH contract, which is the primary outreach that's provided in the city of Bangor?
Sure. No, I don't have the PATH details right now because we're working on parsing that out. So the CHNCS's PATH program serves 5 counties, and that means it serves 3 hubs. And so we're working on updating the data so that I can pull that specifically for Hub 7, but I'm just not able to do that at this time. But in the future, we'll be able to pull that in. Yeah.
And I think that's what I really wanted to make sure that folks understood, is those first 2 columns is work that is done by city staff only.
Yeah.
And that is a small portion of that work. So it's not a complete picture of all of the outreach efforts and outreach interactions. It's likely most of our rental assistance, though, I don't think we get a whole lot of resources from Balance of State beyond what's allocated to us. So the rental assistance is likely pretty close to being wholly accurate, and the outreach is drastically understated. So I just thought it was important to know that. Thank you.
Yeah, no problem. And Jenna will be, Jenna and I will be working together with Jennifer, whether it be the Hub 7 coordinator, so that in the future we can parse those out. We've just implemented the data field so that we can actually start doing that. So it's coming. Okay. And we talked about prior living situations. And then the other information, we talked about leavers. So who's leaving these programs within this time period that we just looked at. And so for the rental assistance, you're not seeing a ton. There was just a few people. So a couple did leave to go back outside. And we had a couple that left a few went outside and a few went to the emergency shelter. And then you'll see a couple people left for the long-term facility, long-term care facility. And then kind of like a whole host of temporary situations. And then there's a continuation on the next page. So there's more in the permanent housing world, but you're not going to see anything for rental assistance of moving into, I don't think you'll see them moving into permanent housing, since that was permanent housing. You'll see that the folks that were engaged in outreach with the city of Bangor, some of them ended up leaving the program and going back outside. And then for the shelters, you'll see that some people left shelter and went outside and or went to another shelter. And then you'll see some went to some institutional settings and some temporary settings. And staying with friends or family, we do see this happening. And when someone is staying with friends or family, they are not considered homeless according to our HUD regulations. So the destination situations. The destinations continue here, and permanent situations, you'll see there were a few that they, rather than using their voucher from the city of Bangor, they decided that they were going to go stay with friends or family on a permanent nature, and they didn't need their voucher anymore. This looks like you had one person that was able to left the rental assistance program with the city for another subsidy. And outreach, you'll see that there was 7 folks in those different permanent situations. And for the shelters, you'll see that a lot of the shelters exits from the shelter were with an ongoing subsidy. Some had no ongoing subsidy. And then sometimes we just don't have a chance to connect with the participants. We're not able to see what happens. They were in shelter for a period of time, whether that's a day or a few days, and sometimes they just leave and the shelters are not able to connect with them after the fact. So you might see things like no exit interview completed, and that's kind of an explanation for what you'll see on those pieces there. Okay. So
Yeah,
the
so-
other, oh, sorry, go ahead.
Yeah, you're fine. Yeah, Councillor Dean.
Just one observation. Do you have any statistics on those that might have re-entered the workforce?
Not based on the information that I'm pulling this report from at this time, no.
But also just because somebody is staying in a shelter doesn't mean that they're not employed, for example.
Absolutely not. Absolutely not. So I could include, if that's something that you'd be interested in, as we're working with Jenna, because we'll be passing the baton to her. Maine Housing doesn't attend city council meetings on the regular, but we're happy to try to pinch hit. But if that's something, Jenna and I can work together to make sure that she has that data, because that is information that's known to the system. I just didn't pull it in and have it handy for you today.
Nice, because I think there's a misconception that all these people are not working and producing.
Yeah,
So that'd be very nice.
Yeah. There are a number of folks in the who work full-time, for example.
Great. So some more data, as you guys were asking for some points here. So we wanted to talk about, Hub 7 was one of the first ones to implement the Continuum of Care's coordinated entry system. And just a quick overview, coordinated entry is not a project. It doesn't come with staffing. It doesn't come with funding. It doesn't come with housing resources. It doesn't come with outreach. But it says, HUD said, you guys have all these different things happening and you get funding for different things such as housing and staffing and all those and shelters and things like that. And we really need you to put together a system and create a system so that you can analyze what's happening. And so that really aligns with the Built for Zero work that we were doing. And I recognize that, the city has been really, really excited to hear about Built for Zero. And one of the challenges is that we didn't have a coordinated entry system existing. So while we were trying to stand up a coordinated entry system, we were trying to implement some of the best practices and learnings from the Built for Zero initiatives. But those things are going in hand, and now we're starting to see the things tumble into place. Things are really starting to gel for us. But to give you some data about coordinated entry, since it started in October of 2022, because Bangor was one of the first, Hub 7 was one of the first to implement or pilot coordinated entry. There's been 1,155 assessments that have been completed, and 1,044 that are unduplicated individuals that have been assessed through the coordinated entry system, which is an amazing amount of work. That's from shelter providers, outreach staff, both the city and PATH, and that is from partners within the community that are willing to engage with participants who are experiencing homelessness and do an assessment for them. CHNCS's CCBHC program is an access point. The Bangor Public Library is an access point. So we're really trying to implement a system that is far reaching so people don't have to knock on the shelter door to be known to us and be counted as someone that we need to think about to solve homelessness. There have been 723 exits from coordinated entry. 302 are exited to permanent housing, and we have those broken down by whether they had a subsidy or not, and so a couple exited into owning a home by themselves. What's significant here is that we had 259 exits from coordinated entry to unknown or no exit interview. And again, that is really getting to the point of where we're seeing gaps. So I mentioned we have coordinated entry. We got to have a system so that we can analyze things. And we had some HUD technical assistants help us design our coordinated entry system. And what they said is you're going to see spotlights on where the gaps are in your system, which is why HUD wants us to put the system into place. And so what you're seeing here is that we don't know where 259 people went. That is what it is. That's the nature of where we're at with, capacity building and funding and all of the things that are there. But that is a significant amount of folks. And then you'll see some other, we lumped them together, staying with friends and family. That was a permanent nature, exited to a place. So some people exited coordinated entry back into homeless, back outside. And then you'll see that 124 of those exits were to other things that we kind of lumped together: hospitalization, treatment, long-term care facilities, death shelter, and transitional housing.
Yeah, we have a question, please. Yeah, Councillor Fish.
The 1,155 assessments, are these a result of cooperating individuals through outreach? And or is this I don't know how you would
Sure.
count that, or maybe our encampments or on our streets that are not cooperating. So who are the 1,001?
Sure. I'm happy to answer that. So yes, and thank you for, I didn't explain enough about coordinated entry. There's 4 phases of coordinated entry: identifying people and getting them access, assessing what their needs are, making a prioritization based on what the continuum of care has decided is that prioritization, and then referrals to housing resources. And then we know that doesn't stop there. We got to work on stabilizing folks and keeping them housed and all of that. But so the assessment piece is where we're capturing the information that the continuum of care is using to prioritize individuals for the limited housing resources that are available. And because it's continuum of care funding, most of the resources that we're looking at are looking for people on that higher needs spectrum. So the permanent supportive housing, it comes with a voucher and it comes with supports to help keep you stably housed. So that is what there's explanations about, we have our policies and procedures for coordinated entry, but this is what that assessment is. It asks them questions about what they have for length of time homeless, recent length of time homeless, if they've experienced domestic violence, if they're unsheltered, and if they have any known barriers to housing. That is all self-report, but we take that information and we created a rubric to help us prioritize when an available housing resource is there, who are we going to match to that, and how do they get matched to that resource? So of this 1155 assessment, I'd say the 1044 unduplicated individuals, that's adults. We don't do assessments on children. They're part of the picture, but they're not completing or answering the questions. And I think it's down to 10 pages, but that includes some release forms, but it's an opportunity for them to share with us what their circumstances are so that we can use that information to prioritize them when housing resources become available. And I don't think I completely answered your question. And so, yes, it's people who are outside, it is people who are in shelter, and people who are engaging that are meeting that HUD definition of literally homeless.
Thank you.
You're welcome. So currently, Jen has just gone through some of this data for us. Currently, she has 432 active people in the coordinated entry project right now. She has, and the numbers kind of almost match to what I just pulled in from the other reports that I looked at. There's 548 that she's getting for numbers who are actively homeless in Hub 7. That was her July data, because we have to give time for the end of the month in order to collect that August data. And then she also wanted to provide some data on the numbers for the Corporate Drive encampment, with a caveat that at any given moment, the numbers are going to fluctuate. So, but right now they have about 98 per coordinated entry data. So within our system, we're able to pull in, when someone does a coordinated entry assessment, we indicate where they're located, and there's actually a place for us to say what's their last known location. And so we're doing we're doing some work on making sure that it indicates that they were at the Corporate Drive encampment. And then she said that differs slightly because there's an active list that someone's managing somewhere along the way that has about 92 people. And again, that could change because people go from in and out of the encampments. They may be in shelter, they may be moving to another area, but that's the best that we have at this point in time.
I have a question, please, Tara.
Sure.
So the 92 at the encampments are not included in the numbers above the 432 or the 548. These are extra.
No, they would be included. We just wanted to kind of hold them. We wanted to single them out. So yes, thank you for asking that. That would be part of the some folks that may be considered actively homeless haven't had an assessment and been put into the coordinated entry system yet. So this is kind of the overall number, the 548, but that would include anyone with that coordinated entry that has for the 98.
Thank you.
You're welcome.
Yeah, Councillor Bertier. Yes, we have a question, please.
Sure.
Does your data show where people are coming from?
We have a way to capture that, and Jenna has just recently asked for that. So one of the fields that we ask for our programs or for our projects is the last zip code of permanent residence, and it's self-report. So that's as good as what is getting reported to us. But we've recently updated a report and we provided that to Jenna. So I'm sure that will be something that she can talk to you about in the future.
Okay. Councillor Fish has another question for you.
Of the 92 or any of those that you're interacting with for assessment, do you have any idea what percentage of individuals that are out on the street that are not cooperating? Would you say 80 or 90% are reactive to outreach? And would you, being out there in the field, would you say there's 10%, 20%? I have no idea, but do you have an idea of those that are participating in cooperative compared to those that are not?
Yeah, I couldn't give you that information because I'm here in Augusta. So I am not in the field and I am not working directly with the participants that are in Bangor. So I couldn't give you that information. What I can tell you is that one of the concerns from the hub coordinator is that we don't have enough folks to really know. So that's one of the gaps that I'm going to talk about here as we move forward, is that we might have even identified someone as, been able to get an assessment done, but there's just not enough bodies to be out checking in with folks. And so that's as best as I can say at this point, is that what we do know is that we don't have enough people on the ground to really get a handle on where people are at. I think most people would definitely be looking to engage, but there's also, that opportunity where it might not be the best day for them.
We have another question, Councillor Fournier.
Just trying to gather my thought here. Do you have a number that's just Bangor proper? Because Hub 7 covers a larger area.
Mm-hmm. It is, we don't have that one out to Bangor proper. I can tell you that unless we included it's missing the path, so it's a little bit of both, but we can work on getting to something that's a little closer. When you think about the shelters, that's all Bangor located shelters, and the City of Bangor's outreach program, that's a Bangor specific program. So we'd be looking at adding in the data from PATH on who's working with participants as well. And then that would give you a pretty good picture once we're able to get to that level.
Okay.
So I just wanted to remind folks, I know we talked about this being kind of like a Built for Zero presentation, and I just wanted to let folks know that, Built for Zero, like coordinated entry, doesn't come with any resources, doesn't come with staffing, but it helps us. It's a kind of like a theory of change. Like, this is what they're doing. They're saying this isn't the absolute answer, but here are things and ideas that have worked in other communities. And so really what they're focusing on, and why you've heard about data and quality data for the last couple of years talking about Built for Zero, is that if we don't know what the baseline is, then we don't know the solutions that we're trying to implement if they're working. And so that's why we want to work on implementing this. That's why Jen's been working really hard to get to a place where we feel like we're getting to quality data. And I'll talk a little bit about exactly what that is, but you'll see that's here, real-time data, which accounts for everyone with name and need. We're talking about creating that shared definition of what a community is trying to achieve. And for Built for Zero, that's a functional zero definition, which means we're able to serve people in our system and get them housed within a certain period of time. We'd like to say as soon as 30 days, but we know the reality of that isn't really happening right now. And then, of course, centering racial equity. So that's one of the most important things is having that data so that we can take a look at what we're doing. Are our programs serving people equitably, and are they actually having the impact that we expect them to have? And I won't bore you with the Built for Zero stuff, because I think a few of you have heard this more than once, but if there's any other thoughts or questions, I'm happy to go as we continue on. So talking about the data quality progress, you can see we have all the hubs here, and we just recently did a dive into what the progress that had been made. And you'll see that in July of 22, when things really started, when we initially started this Built for Zero work and everything, everyone had a 2 because we can collect racial and ethnic data within our system. So we got a bump right from the get-go. We got 2. And then you can see over time the progress that has been made. So this is in reference to a tool that Community Solutions has all communities look for, and it's based on population. So right now we're looking at an all singles scorecard. And on that scorecard, there are 29 questions. And if a community can answer yes and demonstrate yes to 29 of those questions, they're halfway there to the data quality. They're able to identify 90% of the folks who are experiencing homelessness. They're able to outreach folks as they're known in the community. And with that, then we look at collecting 4 months of data. And if that data balances, then we get the rubber stamp from Built for Zero that says you have reached quality data. And you are at a point where you can start looking at what you're doing and finding where those gaps are, trying solutions and seeing and measuring and seeing, are those solutions impacting the way we want? Is having more outreach helping us identify more folks? Is having housing stability reducing the number of people that return from being housed in our homeless response system? So there's just really, we're getting really close, and we're really excited about this because the hubs have been working really hard, and you can see that Jen is in line with most of the other hubs, and it's a lot of work. It is a lot of work to be able to get that buy-in and answer 29 of those questions. And I'm not going to share all of them with you, but I will share with you the 8 that are the challenge for Jen in Hub 7 right now. And you'll see these are some of the scorecard questions. So these ones are related to outreach. And this is where we don't feel like we have enough. And this is not unique to Bangor. This is across the board in most of the state.
I have a question.
Sure.
Why is there such a disparity between like York and Cumberland counties, for instance, in their data quality?
So in their scorecard questions, so I mean, I can show you the PMT trackers. I don't know exactly where York is, but I think a lot of it has to do with data entry of the service providers. So York only has 2 shelters in the county, and they serve a lot of individuals. And there's just those 2 shelters in Alfred that enter data into our HMIS system that we're able to identify. But we know that there are many people that are not able to engage. There's one path worker that covers all of York County, and she's only so good. She can only do so much. And so she's that hub coordinator, and like answering those scorecard questions hasn't been able to say, yes, we have all of these things in place. And so that's the work that they're doing. And you'll see the same thing as a little bit of a challenge in Aroostook County. It's such a rural state, and there's maybe a path worker. I'm not sure if there currently is a path worker that's handling Aroostook County to answer some of those questions regarding having comprehensive outreach.
Thank you.
You're welcome. And I'm happy to share the whole scorecard and all the questions if anyone wants to do that, or you can probably find it on Community Solutions website. But here are some of the things that remain for Hub 7. So is the outreach clearly mapped out, informed by data, regularly assessed, and so that you're able to reach all unsheltered individuals within your community? And you'll see that there's just kind of a theme in here. And that's not saying that the people that are in those positions aren't doing their darndest and aren't working really hard. There's just not enough people. And then you'll see there's a little bit here related to policy. So, can we get to that point? That's a policy piece. And then consistent, coordinated, and reliable outreach that gives you confidence that at least 90% of the unsheltered population is captured in your data. And that BNL stands for by name list. So are we able to really identify 90%? And with capacity issues, we're not feeling that we can. And then the remaining scorecard questions, this first one, question 2B, and this is where, Jen is not feeling confident that she has able to identify 90 to 100% of currently homeless single individuals by the providers that are on the by name list. And you can see that was present in the number of folks that were exiting coordinated entry, where we really just didn't know what happened to them. Our hope is that they're housed, but they could very well still be out there. And then the rest of the pieces are more policy related, establishing a written policy for inactivity, a written policy for accounts for changing an individual status to inactive, and having a policy for when someone exits, if they're entering jail or an institution, if they're going to remain there for 90 days or fewer. So if they're going to remain 90 days or fewer, then they're going to stay actively homeless and on our list if they're going to be there 90 days longer. So those are just some of the policy questions, but you can see that this isn't just like, you know, check a box. There's work that has to be done and collaboration with the community partners to make it happen. Oh, and that's it. So, questions. And I wanted to say with the bottom, that's really important, is Jen is feeling very good and hopeful that she can overcome some of these barriers and hit that data quality milestone in the new year. So that is her hub goal for this year. In addition to coordinated entry and all those other things and the encampment work and the LAMA liaison program and all of the things that are going on.
Any questions?
Yeah.
Councillor Haas?
How often are these figures updated?
Sure. So the scorecard in the BFZ figures, we do a monthly report. So the inflow and outflow of what's happening is done monthly, and we do that we submit the numbers to the tracker on the 15th of every month.
And I'll just jump in to say the client data that Tara pulled is, I mean, they're really updated ongoing. So the HMIS database providers are required to enter their data in certain timeframes, depending on programs. So like shelters timeframes is 24 hours. For permanent housing, I think it's 7 days, but so it kind of depends on the program type. We tend to feel like pulling it on it, giving it a month, like month window, and then waiting, I don't know, maybe 10 days to make sure people have all of their data in the system to feel good about the numbers that we're pulling. But essentially we can pull the data from HMIS at any point because it's actively being entered. It's just a question of sort of how close you get to your report end date when people might still be entering that data.
We have another question. Yes, Councillor Haas.
I did. What was it? Oh, I would assume that we're gonna be meeting fairly regularly with you,
Yes.
and we would be able to have the most updated information as possible when we have those meetings. And the reason I say that is that a lot of these things change regularly, but we need to know as a council going forward, how are we going to approach the different things that are still there and in high numbers. So I guess if we're going to meet regularly, we probably would get a fair amount of information from you.
It will be, and we're setting up the processes to be able to have those regular updates. I'm in really frequent communication with Jen, the Hub 7 coordinator that Tara is referencing. And you know, both Tara and Kelly have been incredible with all of my many data requests. Up until now, it's the system capacity issues that we're trying to work through and to be able to dial down to get the information that we need to really understand what's going on in our community.
I know you're never gonna have 100% numbers, but that's one of the highest percentage of questions that we as counselors get. Is we're hearing so many different numbers at different periods of time that how do we really know what we have out there and what we don't have? So I appreciate you.
Okay, Councillor Pelletier has a question.
Thank you. I recognize that none of the hubs are at data quality yet, but do you have any early indicators about what kinds of programs and interventions are working that communities should be investing in?
Tara, do you want me to jump
I was
in?
going to say Kelly's probably got a good handle on this based on what we do at Maine Housing, but not
Sure,
necessarily related
yeah.
to the hubs.
Yeah, I mean, I don't think, you know, it's obviously not a one size fits all or one answer is going to solve all, but I will say that sort of a approach, a prevention approach with a what we call a rapid rehousing approach is what we try to work towards. So we do fund what we call a housing problem solving program. It's a small program because funding is very limited, but that aims at prevention. So catching people before they enter the system and trying to provide either, not always, but a lot of times financial intervention. Sometimes it's just service intervention to solve their housing, their at-risk or their housing crisis before they make it to shelter. And then we also have a rapid rehousing program, again, small, but there are other rapid rehousing programs funded through other sources, not just Maine Housing, that look to catch somebody in the early stages of being homeless and rehouse them with interventions like security deposit assistance and short-term rental assistance. We also, the state has passed legislation that is going to build housing first projects, and people may have heard of that. And that is in partnership with DHHS. And essentially, that program is really looking at serving chronically homeless with high service needs. And so it's housing that will be constructed and then services that will be partnered with DHHS to provide those. So that sort of aims at a different group of folks who maybe won't be able to benefit from those quick resolutions that I talked about. But I do think it's going to have to be, many different solutions because the reason that people are entering homelessness varies. The length of time they've been there varies. So the needs are going to be very, very different. But I think those things are, proven to work. It's just the funding is obviously always a challenge.
Councillor Fournier, you had a question.
So have you identified a time frame for having data quality for the state of Maine?
I don't know what their goals are. I know they just talked about them, but we can get that information to you next time. But all the hubs are working at trying to accomplish the data quality by the first of the year, but everyone's staggered it based on where they're at.
Councillor Dean has a question.
Yes, this is very helpful. I like having the numbers in front of us, and I'm encouraged that we'll be updated. The 92 that are on the active list in the encampment concerns me. And that's a number that we've always, it's just been out there. We don't know what to say, who's there, when they're coming in, when they're leaving. I feel that the city and the council need to have a written policy on our policy of what we want to do with the encampment. And that's something we haven't had. So now that you're involved, I think it's a good time for us to decide what we need to do, the direction we'd like to go in.
Any more questions? I agree with Councillor Dean. I think this issue has been like critical for all of us on the council. We are always looking for solutions, how to address this, how to support people at the encampment or the unhoused. And I don't know if there is a specific answer to any of those problems, unfortunately, but I agree that we need to have probably more solid answers about, those numbers that we have there.
It's imperative we understand who's in our community experiencing homelessness in order to effectively meet their needs.
Yeah, and I think the numbers that were listed, it is the highest since I have been on the council. So there is definitely a jump in the number of the unhoused and people who are being served in the last year or so. So
I think city manager is joining us.
Yeah, she's working her way.
Yes, Debbie.
It is. Debbie Laurie. So I do want to provide a little bit of clarity on that too. So when the coordinated entries are completed, they were completed at the encampment. That's true. But What isn't clear and what isn't gathered as part of that process is if this is where they are staying at night. So individuals, they have a social network. So there is a lot of activity in and out throughout the day. So that the fact that there were 92 individuals who completed a coordinated entry within that encampment does not tell us that those 92 individuals are actually sleeping there at night. And that's part of the problem as well.
There's a lot of day visiting.
And I would also say, now that we're collecting data,
Right.
we can't really know if it's a lot more if our initial data was 0 because we didn't collect the data, but there was definitely still sort of homelessness here as long as I've lived in Bangor, so. You know, that first batch is always gonna seem like a big number because it's the first number.
I guess that's it. No more questions.
Yeah, thank you both very much. Appreciate it.
Thank you.
Thank you, Jen.
Could I just add a comment? I agree with Counselor Dean that while we're trying to serve our homeless and get the numbers down, it'd be great to think we could get to 0.0. But at the same time, I think we have to also look at some guidelines about how to have better control over situations that's happening around the encampments and around the homeless. And I think that if we reach out and we have services and we're refused, they refuse to cooperate. Or what is it that we're providing that is attracting so many people from not of Bangor, but outside of Bangor? What are we doing, in a negative way that is bringing so many people in, and how can we change that? I know we're a county, service center, and we're going to have our neighboring towns that need our help, but at the same time, I think that we're tolerating a lot more negative situations than we should be. And I think it's our obligation to try to come up with some guidelines and action plans.
I guess we can move to the next item.
Yes, this is the grant application for our housing navigation and stabilization pilot program. I believe that is also Jen.
Hello. It is. Yes, we were recently made aware of a funding opportunity through Maine State Housing Authority that will foster long-term solutions to assist folks who are experiencing homelessness. One of the eligible criteria for the grant are wraparound services that you heard Kelly and Tara talk about earlier. These are the services that help to kind of insulate folks who have experienced homelessness and are now transitioning into housing. What we would like to do is to apply for this grant in the amount of $400,000 to create a 2-year pilot program. What this pilot program will do is to allow us to marry kind of the ability to wrap those services around folks with the ability to cultivate those necessary relationships and support property owners and landlords who are supplying the units that we're helping to move folks into. What this program would do is to allow us to hire one FTE, full-time employee who would function as the city's housing navigator. This would create a systemic approach. Now, there are housing navigation services that are being provided around Bangor, but it's certainly not systemized and it's not readily available to a larger population. What this program would do is allow us to facilitate those types of services. The housing navigator would be able to connect to individuals who are experiencing homelessness, who need to be transitioned into housing with the necessary services that help those folks be as successful as possible. I think we can agree that with limited housing resources, we need to maximize the ability to connect people as successfully as possible to housing whenever we're able to do that. The navigator would be able to liaise with other public health departments, outreach workers, shelters, to understand what folks need going into these placements to maximize what we call housing readiness. This person would also be able to support landlords and property owners by facilitating robust communication techniques, by providing a point of contact so that property owners and landlords understand what to expect kind of going into providing this unit to someone in need. And it would allow us to maintain, those relationships when those placements don't go as expected.
Move staff recommendations.
Yeah, so let's
Second.
take some question, okay, so, yeah. Okay, let's start with.
Well, my
Councilor
question is concerned, I think it's a no-brainer to support this, but what happens at the end of the pilot program?
She's gonna let it pay. So my hope would be that if this is successful, we're actually able to replicate it in other areas. Our focus is making sure that you heard from Maine Housing, the system is not functioning as it should. So while we work to fix that system, we have to work to fix what's happening in our community. So I think at the end of 2 years, we'd likely be eligible for additional funding. Or we'd search for other grants to continue the program. Maybe it isn't successful. And we can walk away. The other portion of this funding is also a lot of discretionary funds. Because what's important is if we have somebody who is housed, we need to maintain that housing. And in order to get them into housing, it is you've got to have 14 kinds of documentations that any one of us would struggle to come up with if you asked us to do it today. We're asking individuals who are ill in many ways, have no access to, a lot of conveniences and resources to do those things. Further, we have seen it where we have moved individuals into units from outside, not us personally, but we have seen it in others, where the person is now standing in a unit and there is nothing in that unit. And so how does that create a feeling of home? A feeling of place if you don't have some basic furnishings? Along that same line, right now what happens tends to be whichever outreach houses the individual is able to work with the individual. They're moving, if they do have stuff or they find stuff, they're actually moving the people in. Outreach needs to be doing outreach. Housing navigation needs to be housing navigation. And part of our ask is navigation and stabilization, because it's incumbent. We need to make sure that once an individual is housed, that they are successful in their housing. Because we do see this, we see a recidivism rate where people, lack of supports, whatever it may be, are falling out of housing. So we are oftentimes housing the same people over and over and over again, and we need to stop.
Yes, Councilor Foss.
When you apply for these grants, does your program have to be pretty well laid out and ready to hit the ground once you hear you've got the grant? Or do you build it after you get the grant? Because it seems like we've applied for things before and they're well worth applying for, and hopefully they'll give us some good information. But if your program isn't ready to go, we lose ground fast.
So the requirement of the grant is that you have to be prepared with the program to start, I think it's February, something or other of 2025.
Yep.
We already have a draft job description together.
Okay.
Because we believe that this application, if approved by the council, has a high degree of probability of being funded. And we do want to be moving. And we've had good luck recruiting. And then we had our outreach position was vacated. We actually filled that pretty quickly. So I think we're a known entity, and it's another position that would fall into public health and community services. We have one individual who operates what was known as our Shelter Plus Care program. I'm never gonna remember what the new name is. You just can't teach me that.
Rental assistance program.
It just can't change. It's always gonna be SPC. Always can't change. So what this will do is allow now a more team dynamic. A lot of those relationships, a lot of that institutional knowledge is rested in one person. So it actually gives us an opportunity to support those efforts. So I think it's a good opportunity for us.
Can I just ask one more? And then I'll
Yes,
stop.
please, yeah, go ahead.
Okay, so you've got the program ready to go. Are you gonna also make part of that program how we can evaluate it starting early on?
Yes.
Multiple times throughout, so that we don't wait until 2 months before the end of the program to find out how successful we've been, which hopefully it will be successful, or if we're lacking, it's gonna be too late at that point to fix anything. So if we had periodic evaluations of it, it would be helpful.
There will be feedback mechanisms built into the program.
Wonderful, you're welcome. Okay, so I think we had a motion and a second. Any objections, any questions? Then it's approved. Thank you.
Thank you very much.
Thank you. Next one.
Yes, we have, I believe multiple from Public Health, so I'm gonna ask Jen Gunderman to join us as director. The first one, I believe, is an order authorizing a revised MOU with Maine Mental Health Connections Together Peer Run Recovery Center to receive up to 50,000 from the state of Maine. Do you wanna give a quick overview of that?
You know, this is funding that we had with another organization as part of a grant. It didn't work out with that other organization, and so now we are shifting the funding over to Together Place, who is ready to go to support the work. They're already doing the recovery coaching and the outreach, so this is just a matter of adding another person to their team.
Move staff recommendation.
Second. That was quick. Any questions, any objections? Okay, I guess it's moved. Thank you.
Wonderful, thank you.
Thanks.
Do you want me to just keep going?
Yeah,
Okay, the next one is an order authorizing application to the Bangor Breakfast Rotary Grant to assist with funding for prenatal and postpartum support group.
Yes, so every Friday at the library at noontime, you can find 2 of our public health nurses working with people who have given birth and have newborns, and who are there for postpartum support and breastfeeding, lactation, advisement, and also support. It's been going on for a number of months now, probably close to 7 or 8 months. There is regular and increasing participation from new parents. It's really a safe space. I've gone a couple of times, and not just to hold babies, but to really see how the work is going. And so this funding is really to help support things like the cookies for the milk and cookie part of that program. Right now, public health nurses are actually making the cookies themselves and bringing them, and also other educational materials and supports that these parents might need. In terms of evaluation, we're going to be working with a USM student to do evaluation of the program now that it's been running for a few months. And so the grant to Rotary is to really for material support.
Move staff recommendation.
we have a motion. We need a second.
Second.
So any questions, any comments?
I would just add one comment,
Please.
that one of the things about all of these new mother support groups, they never cater to the working parent. And I would just like to put that on record, that having support for working in when Central Street Farmhouse first opened, they actually did. And I met a friend there, and our daughters are 14 years old and still besties today from that meeting. And it was a different type of support. We'll talk about parenting, breastfeeding, pumping at work, all of those things. And it was the only thing that everything else is.
What time was it at?
It was like at, I would say it was like 5:30 or 6.
Okay.
And we would just bring snacks and kind of like eat dinner or whatever. We like bring our own thing, but it was a fantastic resource. Didn't exist for my first daughter. And then we kind of took it over and brought people in because we just kept it going for the owner because we found it so valuable. We were there until our kids were like 2 years old, just being the mentors, but it was hugely impactful and is a huge area of need.
Thank you.
Mothers.
I'm going to bring that back to our public health nurses to see how we could be flexible in some ways.
Yep.
Thank you.
So we had a motion and a second, it's approved.
Great, thank you.
Right.
Yeah,
Next
the next one is application for 1.2 million through the Maine Continuum of Care for a funding opportunity for the Bangor Rental Assistance Program, formerly known as Shelter Plus Care.
So this funding is a renewal, and this is the funding that we already have through the Maine COC to do our voucher program. So it's a renewal, nothing new being proposed at this time.
Yeah, and I think we've had it for like 20 something years.
Move staff recommendation.
Second.
Yeah, I have a question, please. So we we learned about a pause in one of the vouchers in the past few months.
So is that the BRAP vouchers that you might have heard? Those are different vouchers that are provided
Okay.
directly by the state.
Okay,
The rental assistance vouchers, there's no pause on
No
them.
pause on
We just
this.
keep giving them out until we
Okay.
have no more.
okay,
And we have no more.
And we have no more.
okay.
And so we get creative on how to support outside of that.
But- Okay, so we had a motion, a second, no objections, it's approved.
Thank you.
Next one.
Yeah, the next one is authorization to apply for 8,000 for in 2025 enforcing underage drinking laws grant through Durgo Safety for the police department. Is that you? Do you?
That is not me, but I'm
Oh.
happy to talk about it now.
Oh, Debbie, do you? I'm sorry, I actually, my eyes, so I was on vacation last week and my eyes read this to be a public health item, but apparently I was wrong.
It's a great opportunity to have some targeted enforcement on underage drinking that would support our police department specific efforts. It was a grant that our grant manager found.
Oh, that's great.
Yeah,
So this is a new, I
It is a new
remember
one.
we
Yep.
have had this before.
so
Okay.
it's not unusual to have targeted funding opportunities for particular times.
Mhm.
This one just happens to be targeted for underage drinking, so.
I would move that recommendation.
Second with a question.
Yes, please.
So this should be for the police officers themselves beginning with, because Diablo does a program, where they use underage kids to go in and try to set stores up.
Correct.
This is the officers themselves doing it,
It
not
would
using
be,
underage people to
correct,
try to trap people.
correct, it would be city use.
And wash them all direct.
Right, exactly.
So, yeah, so I think I'm still confused
Yeah,
how,
yeah,
how
you
they
can
will be
go-
using this fund, like, so it's,
I
is it-
have even, I don't.
okay,
Can I
okay.
go,
Thank you.
let me see what it says.
Provide enhanced training to officers related to liquor enforcement laws and increase enforcement of underage drinking laws.
Okay.
So
So it
don't
would be-
party in the woods, kids.
And let's just say, you know, I don't know what I can say that when I was in high school, there would be certain times you perhaps would be looking for a certain activity. From. Correct. So I believe it would be stipends to allow those kinds of, and paper overtime related to those assignments, as well as additional training.
Okay. Okay, so we had a motion and a second. If there is no objection, this is approved. And we move to the next item.
Yes, which is an update from
yeah.
our public health
Which is why I thought it
director.
was-
Yes.
So thanks for your time this evening. City Manager Debbie and I had talked about after my last update that it might be helpful to come on some routine basis to be able to provide you an update from public health and community services, particularly with some of the issues that are affecting our Bangor community. So I thought I would do that this evening and answer any questions. So my first thing on the list is these chilly mornings are a blessing in public health because that means we're getting closer to killing off mosquitoes. So the first thing on my list is to talk about arbovirus disease. So arbovirus disease is otherwise known as a disease that you get from an insect. And specifically this time of the year, we move from Lyme to thinking about mosquito-borne diseases. So the CDC, the main CDC provides what's called an arbovirus report every week, where it details what they have tested in terms of human, animals, or mosquitoes, to give people an idea of what's happening. So in the, let me get my glasses on to remember the exact dates. So in the end of July, a crow tested positive for West Nile virus in Bangor. That's not a shock. West Nile virus is here in the state of Maine, but that was just kind of confirmation that West Nile virus is circulating in this area. And then in mid-August, Triple E was tested in an emu in Penobscot County. So again, just another indication that Triple E, otherwise known as Eastern equine encephalitis, is also in the area. Both of those diseases definitely affect the neurological system. Eastern equine encephalitis a little bit more seriously so. There's no vaccine for either of those diseases except for Triple E in horses and some other animals, but for human there isn't. So what that means is really just personal protection and mosquito control. For people, be aware of dusk and dawn when mosquitoes are most active. cover up, use insect repellent. For environmental controls, that's keeping mosquitoes outside. In other words, tell the kids to close the door and make sure that standing water is removed when possible. So just want to make you aware, there is some, there had been concern like there's increasing numbers. There isn't. That's been a little bit of maybe misinformation. When we look at national trends, right now, the federal CDC is reporting that there isn't a dramatic increase in West Nile virus or triple E at this time. Could change next week. But I just want to caution you that we're not experiencing this incredible urgency.
Council Chairperson here has a question.
Thank you. At the council meeting last week, we had some concern that there's some standing water at a housing development that's going in. What are we doing to address that specifically?
So, part of our routine, monitoring of that site is we have staff on site, who routinely walk the site and look for issues, related to that project. That walkthrough had already occurred last week when I met with those folks. So this week, they will be looking for particular standing pools of water that they can identify. I will say that there is a large retention pond, that is part of the development. But the outlet is in place. So the water is flowing out of the retention pond as it was designed to do. So in that case, that water is moving. So it is not stagnant water, which is where you would typically see a pooling or be particularly concerned about
Absolutely.
mosquitoes. So
Thank you.
I'll have more information later next week.
And all our departments at the city are aware of this. And so I've had communications with Tracy and Public Works about keeping an eye out, and they're well aware from city perspective.
And I have a question about those viruses, please. How to raise awareness without scaring the public? How to, like, there are many families maybe who might not, hear much about this. How can we reach out to as many families as possible, especially with the little children?
That's a great question. Typically, the schools, Maine CDC will often communicate with the schools around appropriate insect, mosquito prevention. But that's something that maybe we can check in more with the superintendent. That's typically the best way to get information out is through schools. But let me follow up on Dr.
Please.
Robinson on that.
Okay, thank you. Okay.
I also believe it's made the news as well. So that's another way. It's a challenge, particularly with so many other public health, avian flu, but you're right, we can be doing a little bit more targeted education.
Thank you.
So my next update is about the HIV cluster. So as of last Thursday, we remain at 13 cases confirmed in the Bangor area. The Maine CDC now has a website available where they are updating the number of cases and basic data on a weekly basis on a Thursday. If you Google HIV cluster, Penobscot County, it will lead you right to it, and I'd be happy to share the link. So information is posted there and it's updated every Thursday.
Yeah, are these people in the general population, these people, unhoused people, or this data?
Great question. What the CDC is reporting is that of those 13 cases, all 13 are co-infected with hepatitis C. All 13 cases have reported injection drug use as the risk factor, and 11 of the 13 cases have reported being unhoused in the past 12 months. I do need to clarify that the way that our public health system is set up in Maine, all reports of infectious diseases that are reportable go to the state. We do not have access to that data. So any data that anyone would want, we go to the state to request that.
But those is Bangor specific, not the Bangor
They
region?
will not clarify that it's just Bangor.
Right.
They will say Bangor area.
Okay.
Yes, Councillor Dean.
Well, I have a concern about the needles that are found in Bangor and people picking up their own needles. I just think we need to make sure that people know to contact VCAT. Lay people don't know how to handle needles. They don't have access to gloves and sharps containers. And it makes me very nervous when I hear people cleaning up their own.
Thank you.
Not their own needles, but needles on their own property.
Totally agree, and thank you that you bring that up. Currently, we have a contract with HEAL, and they have a hotline number and an email to, where people on private property can request that those needles are picked up. We are at Public Health and Community Services with City Manager, Debbie, are looking more closely at what needle waste and needle pickup needs and challenges are with the city right now. That's a top priority.
Just a follow-up. I've got the poster for that in my business. Do we have posters or notifications in the city parks about the number to call for needle pickup? I mean, a
Yeah,
lot of times I have
we
people that
have-
see them in the parks and
Yeah.
they don't know what to do.
Yeah, we did end up with a bunch. I'm sure that,
Yeah.
we could find or develop more of those
Right.
and have those
Or
available
like
to
the,
hand
you know,
out.
permanent metal sign that could go in the parks,
Yeah.
not the paper ones.
Yes.
Absolutely. Also sort of an update from Maine CDC. Maine CDC Director, Director Va, State Epidemiologist, Dr. Benowitz, and one of their strategic consultants around emergency preparedness met with myself and Jenny Doyle a couple weeks ago to hear what some of our concerns were about the messiness of the challenges around coordination around the HIV cluster. And as a result, the Maine CDC is setting up an incident command or a unified command structure from DHHS. And we were formally invited to participate in that incident command structure. So I'm participating in some of in the planning meetings, and I've been having regular communication with the state epidemiologist to talk about the challenges and the need for response efforts here in Bangor. I will say that a lot of organizations in this area have really stepped up to provide much needed resources and services to prevent further spread and to care for people who have been newly diagnosed. At Bangor Public Health specifically, we've been doing a lot of education with local organizations. We have now developed some educational materials to share with the impacted community in the encampment and other parts of the city, which include not just HIV facts, but where people can get tested, where they can get pre-exposure prophylaxis and other resources. And then we're also offering support. Today we're able to share that we are now, we've been able through our rental assistance program, find housing for some of the people experiencing a new diagnosis who are unhoused. So we've been working very closely with our community partners to also provide that support. A couple of other quick updates. Flu is around the corner. Our public health nurses have been scheduling flu clinics with many of the schools, with city employees. And we'll have flu available in our clinic at 103 Texas Ave. Also with the clinic, we implemented walk-in hours on Mondays and Wednesdays from 9 to 12. That means people can come in without an appointment to around immunizations or around sexually transmitted infection testing. We don't do travel vaccine during walk-in because that's a whole process. That needs a little bit more time and preparation. And talking with Jenny Doyle, the community has really taken advantage of that walk-in, and we're seeing a steady flow of people during that time. So we may, looking at the data, may offer some other opportunities for that. At one point, they did some evening times, and we may revisit that. Another update on accreditation. The last time I spoke to you, I asked for your permission to approval to apply for a fellow with the University of Southern Maine Innovation Project. We did not get that fellow, which is okay. But we did get approval from the state with some of our infrastructure funding to hire a person that can be focused on performance management, quality improvement, and accreditation. So we're moving forward on that. Jenny Doyle and I attended the National Association of City and County Health Officials in Detroit, Michigan, back about a month ago.
Tell the best part of the story. You
Oh,
actually stayed
The
in
best part of
Canada
the
'cause
story
it
is
was
we actually
cheaper.
stayed in Canada because it's cheaper. And every day we took public transportation over to Detroit, and we had to go through we had to go cross the border, so we had to show our passport twice a day when we crossed the border, so that was a lot of fun. But it was a fantastic conference. It was really a conference that we hope to attend in the future. We were able to use some of our infrastructure funds to go. We're the only local health department representing Maine there. We learned a lot of great things. There was some solidarity with other local health departments to learn from each other's successes and challenges. So we represented Maine, and it was a really great opportunity. It gave us, maybe a little national attention to be there. My last one is the opiate settlement funds. I was here some weeks ago to give you sort of a really general idea of the road that we were going down around how to use our opiate settlement funds. Just want to give you an update that we took your feedback. Right now we're looking at putting together and drafting a more detailed proposal that includes timeline, budget, a link to the evidence, other places that are doing something like this, and that will be coming to you soon.
Councillor Fish.
Hearing the report earlier from the Catholic Charities and seeing that we have 80 to 100 families coming in. And they're probably, I don't know what their medical history is, and I wonder, do you have any involvement, do your department have any involvement with these 80 to 100 individuals? And if so, what involvement is that?
I'm so glad you asked that question. We do. We help to provide some of the immunizations for some of the people who are settled here in the Bangor area. We met with Catholic Charities about a month ago and even talked about what would be the opportunity to do some education sessions with people. I did something very similar in the Portland area. People who resettle in Maine that come from, say, the Congo do not know what winter is. So like, how can we help and to understand what are the health issues here? Probably haven't heard of Lyme disease and ticks. So we're looking at ways and opportunities to provide some health education in a culturally appropriate and linguistic way to people who are being resettled here.
Questions?
Thank you.
Thank you so much. Thanks. That was thorough. Thank you.
If you don't mind.
Yes,
Uh,
go ahead.
I probably should have mentioned ACM update was on the agenda, Assistant City Manager. Just two things really quick that I wanted to touch on. I believe it wasn't that long ago that I updated you with Community Connector. There's a lot going on with technology, the Cold Bus Barn, rehab project and things of that nature. Things related to those are good. However, we're currently down 5 drivers, several out due to medical reasons. And so we're kind of back in that spot where we have multiple doubles a day between ETO, folks calling out and things like that. It could be a struggle. And so quite likely in the near future, we will likely need to reduce service and combine the Center Street and Hammond Street routes, which we did actually for a couple of years successfully. It's a fairly minimal impact. And so it saves essentially 2 drivers a day, which makes a big impact when you're trying to find like 5, for example. And so we're doing everything we can to hopefully stem that. We're actually meeting with the union tomorrow, hoping to find some creative solutions. So I just want to give you a warning that will be noticed out once final information is determined and the date and all that other stuff. And then my other thing is website related, a little happier news. That is actually on track to launch next month in October, which is really fantastic news. We put a lot of time and effort into that website for it to be accessible, for it to be educational and easy to navigate, and to also look appealing and things of that nature. And so we're really excited that is moving forward. And that's actually, unless you guys have any questions, that's all I have for today.
Yes, Councillor.
I have a question, but it's not about her 2 items.
Okay, so I have a question about the drivers.
Yeah.
We're back to I feel like 0.0. I mean, we made some progress and now we're
Yes.
back. So when you say 5 out, not temporarily out,
No, those are vacant positions.
vacant, so I bet you're actively seeking.
Oh,
you know,
yes,
to
of course.
hire.
Yes, absolutely. And one of the things that we've been talking about for a while and we want to work out the details with the union is to actually create two separate classifications of drivers. Right now, we use folks that are driving fixed route that require a CDL license interchangeably with the ADA paratransit, which is just a Class C license that most of us have in this room. And so if we're able to separate those out, then hopefully that will free folks up to drive more fixed route, and then it'll be easier to backfill the ADA paratransit because that licensing requirement isn't there, the barrier is gone in that way. So things like that, we're being creative. And I will say that I harped for a long time about how bad like staffing was at Community Connector. We are not that bad right now, but we feel like we're backsliding pretty quickly. We made really good progress. We had a lot of the training and things like that. And so we're again trying to stem that so we can get back to the point where we can offer more training. And of course, if folks come to us with their CDL, we will still help them get their P endorsement. It's a lot more work to do like a full-on CDL class. And honestly, what we found too is that oftentimes folks think that driving with a CDL is a great idea, it's a great opportunity, and then driving around Bangor with a 35-foot bus is not something what that's like until you're in the driver's seat, and that's just not for everybody. So honestly, helping folks get their CDL can be hit or miss in terms of whether or not it's a good fit for folks because of that sort of learning curve that comes with it that you can't experience until you get there.
Okay. Yes, Councillor Dean.
Do you provide a vehicle for someone to get their CDL? So they're already, driving?
We do
from work,
everything. We give them the training in the bus, like the book work and the actual road and range. Yes. To be fair, we've only done that once with Community Connector because again, it's a lot of work. It does require folks that would normally be driving a bus to actually be instructing. There's a lot of requirements around that now from Federal Motor Carrier in terms of how that works. Aaron's team at Public Works has actually been a little more successful with being able to do that, but the nature of their work is honestly quite different than the Community Connector. They sometimes are driving, but not always. So there's a bigger mix in terms of what they're doing for work. Community Connector, you're there to drive for the most part and provide that customer service to our riders. So, but yeah, we are, we provide them everything, the books they need, the assistance to actually get their licensing and all of that.
Thank you. You had a question?
Oh, yes.
Related.
It's for Courtney, but it's not about
Yes,
her
sure.
two items.
Yeah, go ahead.
Would it be possible to get copies of the Catholic Charities presentation?
Oh, absolutely. I have it. I can forward it.
That would be good.
Yep.
And because I'm getting a sense that a lot of that material was new to most of us.
Yeah.
And it would be nice to have time to really look at it, process. I'm sure there'll be more questions.
Yeah.
And then maybe have them back, I don't know, November, December.
I am
another
sure that they'd be
discussion.
happy to come back. And what I can do is I'll actually make sure it's on the website too, that presentation, so that folks don't have to go watch the full video in order to see it. And I'll make sure that's available.
Okay, great.
Yeah.
Thank you.
Okay.
I move we go into executive session 1 MRSA section 4056F, workers' compensation settlement.
I need a second. We have a motion. I need a second. So we have a motion, a second, roll call vote. Yeah, so Councillor Fish.
Yes.
Councillor Trimble.
Yes.
Councillor Haas.
Yes.
Councillor.
Yeah.
And me, yes.
Yeah, we are.
We are back.
Okay.
Right, I move, we're live. Sorry.
I'm glad you said it.
I move, to settle the workers' compensation.
Do you want to read does she need to read the whole thing or no? No.
No, just move to approve, yep.
So we have a motion,
Second.
so motion a second. It's approved, right? That's,
I think there might be an order, yes, at the next council meeting.
okay,
Yeah.
okay, perfect. So we get to the conclusion of this meeting. It was long. But the rest of you stay tuned for our next committee meeting, Business and Economic Development.